Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now today's topic we're gonna talk about gallstone pain. Well, we heard a lot of people that suffer from gallstone and they remove the gallbladder, right? So today we're gonna introduce what is gallstone and where it comes from and what is the symptoms, okay? And as well as what acupuncture point and acupressure point that you can do to stop the pain, right? Um, then there is something that in Chinese medicines that we actually use the point it called gallbladder point to detect, to test out whether you suffer from gallstone or not, whether the pain is from gallstone or not, right? I'm gonna introduce the point. This is acupressure point, right? And you can press on the point. It can treat. It can relieve. It may relieve gallstone pain. Yeah. Okay. Let's start. Let's talk about where it comes from first and what is gallstone. All right. Now, if you I see that. Hi, Carol. How are you? Hi, Amida. How are you? On Facebook, and when you up on Facebook or on YouTube or Instagram, please say hi to me and give me a thumbs up and say hello. And let me know where you come from, whether you're an acupuncturist or you're not an acupuncturist. If you're an acupuncturist, please reply 1. If you're not an acupuncturist, just reply 2. Right? Simple. Then let me know whether you're enjoying my live video so far. And I want to let you know that you can leave your comment down there. Hi, Dragona. You can leave your comment down there and let me know what do you want me to help you, or let me know whether there is any conditions you're in pain. Then I will be able to help you by suggesting you some acupressure point that you can do. If you're an acupuncturist, yes, you may let me know that what case that on your hand right now is difficult and you want some advice, and I'm happy to do that if I know it. All right. Hi, Kika Asta. How are you? Hopefully I pronounce it right. So on YouTube, please say hello to me. And hi, Miles from Philippines. Nice to meet you. Now, today we're going to talk about gallstone, right? Gallstone and how does gallstone develop, right? And the symptom about gallstone. And we're going to introduce what acupuncture point, acupressure point that you can press on or you can put needle in, then to release gallstone pain, all right? And of course, the best way is actually, yes, just Kika. Kika, very nice man. I remember when we were little, there's a like a Play-Doh things for kids. It's called Kiki Lala, and actually they a brand that make a lot of clothes. They sell in Malaysia. Hi, Julia. Okay. Yep. Please, if you're on Facebook, please click share. So share this video on your Facebook page. I don't know about an Instagram. Can you share this live video on Instagram? I don't know. You probably know better than me, because I see that people in you like Instagram a lot. I don't actually personally use Instagram a lot, but I'm trying to learn. Can you share a live video on Instagram? Can you do that? I have no idea. Can you let me know whether you can do that or not? Oh, I can tag some friend over here on my actually on my Instagram. I just realized that. All right, let's try it. Now, I want you to do the same. Please share it because we're going to talk about ghost town today. And I'm going to show you some point that is one point that called go bladder point, and that can test out whether you suffer from gallstone or not, whether there is any problem in gallstone or not. All right. So I've sent something on what talking about. What am I talking about? We're talking about gallstone today. So for acupuncture and acupressure point for gallstone, and I'm going to introduce one point that is actually can test out whether you have gallstone or not. And when it can test out, you can needle it as well. Okay, you can needle it as well, and that can help the gallstone pain. And really, you need to pass out the gallstone. And to be honest, pass out the gallstone, there are many methods, and I haven't been able to do acupuncture to pass the gallstone out, but we can do Chinese herbs to help the gallstone pass out. Okay, and of course, there are other methods that it's easier to. You don't have to go. You know, you heard a lot of people get go gallbladder removed because of gallstone. You know, and you don't need that actually, and that is a way to pass it all out. Okay, and you need to understand where the gallstone developed from, you know, and then therefore you can prevent it come back because it happened once and it can happen again and again and again. You know. Okay, let's talk about. Let's see. I've got something. So what is gallstone? So first, where is your gallbladder? Your gallbladder is over here, right? It's over here. Is the gallbladder is a small organs, okay, below liver in the upper right abdomen, which is over here. So the liver is over here, right? We introduced the liver the other day, and it's just right below liver, and you can't touch it. Actually, you can't touch it. You can't actually feel it. Okay, it's like a small punch, you know, that store bile, you know. So bile is a yellow, a green yellow liquid, right? That helps with digestions. Then most gallstones from where there is too much cholesterol in the bile. Well, have you ever known that gallstone actually most of them actually develop from cholesterol? Do you know that? Have you got any idea of that? Because we know about calcium, right? From right side of the stomach, it's opposite when you. So that's why. You know why? If I show you on that side, it actually on my left side. So what happened in here is I'm using Instagram. It's actually I don't know how to turn because I'm using the camera that is on the screen. So if I'm using the other side, then look, this is the right side. Then you will look at on the left side right now because the front camera. So if I say this is the left side, you see, okay, this is the right side right now because of the camera showing. I'm sorry, confusing you. I'm pointing the right direction and on the right side, but when you look at it, you will look at on the left side. I'm so sorry about that. I don't know how to set the setting on Instagram, but I can do it on Facebook. But unfortunately, if I do it on Facebook, the color will change. We tried it a couple of times, it'll go dark. I don't know why it happened in that way, but let's try it again on Facebook. Thank you for understanding. Yeah, it happened again on Facebook. I couldn't do that on Facebook. Yeah, that's great, Kika. Okay, let's keep going. Now, according to the Harvard Health publications, right, 80% of gallstones are made of cholesterol, right? Now we heard a lot that the gallstone actually come from the calcium salts, right? Thank you. Yeah, we heard a lot. It's actually from calcium salts, right? And bilirubin, right? Those are the, thank you for understanding. So those are the main cause that we normally heard when we were in medical school, and all our professors say, yeah, the gallstone actually formed by calcium salts. But in reality, formed by calcium salts only 20%, and 80% of gallstone is actually developed from cholesterol, right? There's a new research in America that show that. Okay, let's have a look on what about the symptoms. Okay, the symptoms. So gallstones can lead to pain in here in that area because weight gallstone, but the pain would not just stay in here. Okay, sorry, I should point over here. Okay, so you know it's actually on the other side, opposite side. Okay, so the pain will become to the stomach as well. Okay, so, and you probably can't, but most of the time it's in here, but it can relate it to the back as well, right? It can come to the back pain. Okay, but it should be in here, which means pain can be happen in the back or to the stomach, to the stomach as well. Okay, and you may start to have gallstone pain from time to time when you eat food that are high in fat. Okay, which is greasy food, right? Such as fried foods, you know, quite oily, right? Greasy, and it as soon as you eat all those things, and it happened again and again, and it will subside, you know, and then you eat again, it happened again. All right, so it really actually relate to what you eat as well. Okay, so the pain doesn't usually last more than a few hours, and that is very uncomfortable. You can feel it, okay, I have this kind of patient, and um one of my patients, she came in and she wanted me to help her to pass it out. I said, well, I take the post and I check all that. I said, you're not on the right track to pass it out yet, because passing it out is quite painful. It would be painful. And she said, I'm not that bad yet, but I could really feel it daily. So we do, and she afraid of acupuncture. She can't bear the needles. All right. I say, okay, well, let's try herbs. Okay. So we try herbs for a while. And I said, well, you're on the right track right now, pretty good now. We can pass the stone. And then she went back to China for holiday. And then when she came back, and she came back again to me and said, I'm pretty good. He said, I'm pretty good. It hasn't been happening, no pain. I decided to just put it off right now. So she hasn't been had any symptoms for about 2 years. Okay, since the treatment. Gallstone's still there. The gallstone's still there. It's just nothing's happened since the Chinese herbs, right? So that, which is pretty good, you know. But she get her husband to come to see me, her mom to come to see me, and she took all her family came to see me, and for Chinese herbs and acupuncture. And I asked her, how's your gallstone? She said, pretty good. I don't need any treatment at the moment. So here you go. I told her that, yeah, it's better to watch what you eat, you know. And the other thing is, um, if you know that you have stone in there, one is take care of what you eat. Second is, we know it. It's better off we pass it out, especially when you're strong, you have a strong body, and your body's ready, and it's time to pass it out. And for those people, they are in pain a lot, and they're very weak, and you try to use Chinese herb to pass it out, to force it out, it doesn't happen that way. they're too weak to pass it out, and it's going to be a lot more painful. So in general, in my opinion, if it's not an acute problem, we build up the constitution first. All right, this is my opinion. All right, what is the symptoms? Nausea, like want to vomit. Okay, some people really vomit. They vomit. Okay, so nausea, vomit, dark urine. Okay, and the stool change the color. It's come with a clear color, like yellowish color. Stomach pain, as I said, pain over here, it can come to here. Of course, pain over here is where the pain is. Okay, sorry, it should be, if I say here, you see the right side. Okay, I'm touching my left side, and you see on the right, you show you on the right side, but actually in here, but you will show it on the left side, but actually on your right side. Okay, I'm not gonna show you where it is. All right, and burping, and burping is one of the symptoms, and diarrhea, and cause indigestions. Okay, because it blocked out. Why I call indigestions? Because when the stone blocked the track of the gallstone, the gallbladder's track, and it no longer pass out the bile. Okay, the bile. The bile is actually developed from produced from the liver, and is stored in gallbladder. When you eat food, and it pass out from gallbladder again through the tract, and then go into the intestine. Okay, and to help the digestions. If it's blocked up, then there is less and less bile to pass out, to release. Then it actually affect your digestions. Okay, that's why we call indigestions. All right, that's it. It's very simple, and I hope you all understand where it comes from now. I'm gonna show you some acupressure point and let's say it about the point first. So if you on this point, I want you to give me a thumbs up, and thank you very much for thumbs up and love. Thank you, Kika. Lovely. And I want, please share this video on your social media. If you're on Instagram, if you know how to share it, please share it. I don't know how to share it personally, but I know Facebook, you definitely can share this. Please share it. And on YouTube, please afterward take the link and share it. Thank you very much. Hi, Milana, nice to meet you. So I'm going to show you the I think Yang Ning I don't know the code name. The code name should be GB34, I think. Is it? So if you know how to locate GB34, and it's about 2 chun right below GB34, okay, then that is a gallbladder point over there. Then you just go and use your fingers on top of the skin and just rub it like this. If you can feel the patient can feel sensitive over there, then we're quite sure the pain from here is from the gallstone. Simple. Sometimes you rub it on top, is not as painful. You press it a little bit. It is very sensitive point over here, 2 chun below GB34, Yang Ning Quan. I think it's GB34. You press it and you feel that it's very sensitive in there, then that is gallstone pain. Okay. Then what you do, you can press the point, or you can insert the needle over there, either side. You have to test on both sides. Okay. Sometimes it appears on both sides at the same time. Sometimes it only appear on the right side, sometimes appear on the left side. Okay, either side will have the point, but the pain, when it's from when the pain over here, you want to see whether it's from gallbladder or the liver. You're not quite sure. That is the point that you can check to tell if the pain is related to gallbladder. Then hey, you will find the point over here. It's very sensitive. All right. So next, as usual, I normally show you the acupuncture point and acupressure point. Then in this following acupuncture point and acupressure point, what you can do is straight away put needle in or give it wrapping, do some acupressure point on that, and you normally may get instant relief from the gallstone pain, right? And you will see this is actually step by step from acupuncture 1, 2, 3, which is balance method acupuncture. Okay, follow that step. But I'm gonna introduce you which step is that. I'm gonna give you the go to the conclusion directly, show you the point, the area. Okay, so you will see that the point, the area is actually same as treating the liver. Why is that? Because gallbladder is just an organs just underneath the liver. So when you treat liver, you treat gallbladder. And when you find the pain won't be just in one spot over here. The pain normally is in the full area and actually cover gallbladder. Okay, so I'm going to show you the point right now. So your upper arm, halfway of your upper arm. So if you're an acupuncturist, you're going to do on 3 in meridian, halfway from here to elbow. Simple, right? So how to get to the point? If you're not an acupuncturist, this is how I'm going to show you. So if you've been following my video, if you watch the liver point, liver enlargement liver, then you know how to do this point already. So halfway, okay, so from here to here, you want to find the 3 meridian. The first one, how you do it is bend your elbow a little bit and use your index fingers, touch here. There's a tendon, so there's a point that next to the tendon, which is on your thumb side, right? So on this one is actually on a lung meridian. So you're gonna press, use your fingers, use your thumb, and press and rub to see whether it's sensitive or not. If it's not, like in my case at the moment, there's no sensitive point in there, but a lot of people have sensitive point over here. And move up a little bit and press it. There's no pain for me, no sensitive point, nothing. Okay, a little bit sensitive over here, so I can just rub for about 9 seconds, 15 seconds, or 30 seconds. All right, and it can up to 1 minute. Just rub here and here. For you, if you're an acupuncturist, simply put a needle over here. Right. This is 1 meridian, so 1 area from here up to halfway. Okay. Second meridian, we call pericardial meridian, which is bend your elbow again, not fully bent, okay, just halfway. And you see hand over here on the tendon, the point next to the tendon, which is on the little finger side over here. Then again, do the same thing, press and see tendon, nothing, nothing, nothing. Okay, there's no tenderness spot on here either for me, nothing. Nothing at all. So on here, nothing. So I don't have to do anything. I don't have to put needle in here at all. Third meridian, fully bend your hands, your elbow, so you can see that the crease, the end of the crease from here up to here. So go there, press there. Oh, that's tender. I need to press here for 9 seconds, 30 seconds, or 10 seconds, up to you, or even up to 1 minute. All right, so then keep going. Oh, I feel tingling up here, over here, so I can press here for tingling up there, and that's normal. The tingling is not normal. You need to work on that gently, work on it until one day there's no tingling up here. All right. Okay, nothing. Just 2 points. If you're using needle, put 2 needle over here. You find that when you put needle or on the sensitive point, bang, you will get instant relief from the gallbladder pain. Right. So if you're not an acupuncturist, you want to aim to do the acupressure point once a day, at least once a day. Then what happens is whenever you feel pain, you give it a go. Okay, so you can do all the point even longer than 1 or 2 minutes, and it's fine as long as you're not pressing it too hard. You just be gentle on it. Okay, and sometimes you need to do it harder, but you can control the pain, you can bear the pain. You don't, it's not like the harder the better. When you see the result, that's it. Okay, and if you do it too much, like you bruise it, don't worry, it's not gonna kill you. Okay, if you bruise it, which means you do it too hard, don't worry, just give it a rest, change to the other side, do the other side. So the bruise normally will release, will be gone in 1 or 2 days. Some people just 1 day, and some may take up to 1 week. If it's worse, it may take up to 4 weeks, which means your blood circulation is very, very bad. Okay, that's so simple. Do you guys all get it? If you all get it, please give me a thumbs up. Do you have any question? Do you want me to ask? Do you want me to repeat again? We do on the right hand large intestine meridian. Yes, Sunita, TJs, you can do it on the large intestine meridian. Hi, Luli, 你好. Now, if you're an acupuncturist, you know I'm doing on 3-in meridian, right? You can do on 3-yang meridian. If it doesn't work well for you, you do a 3-yang meridian and it will still work. Remember, when you do from here to here halfway, you need to cover 3-in meridian or 3-yang meridian. Because what I do, 3-in and 3-yang, it's cover all this area, all the meridian. So you don't have to go to find out where exactly the pain is. As long as the pain is from gallbladder, then this area, those 3 meridian, you find this sensitive point, it will definitely work for you. Okay, well, the best thing is pass out the gallbladder and gallstone, not gallbladder. That is terrible, isn't it? Pass out the gallbladder. Now the best thing is actually get rid of the gallstone. But can you show again leg point? Yes, I can do that. No problem. No problem, Kika. So to pass out the gallstone, you need to know how to use herbs. Okay, you need to know how to use herbs and to be able to pass it out. But there is another way to use. You can search it in Google. It actually works. Okay, I don't know about in English on Google. You use apple juice or cider vinegar and Epsom salt and olive oil. Okay, olive oil. On those three things together, and do a fasting, and with those things, and it actually will help you pass out the gallstone, and it works very well. A lot of people use it, and this is one of the strategy that I actually use in my clinic. Okay, without herbs. Okay, I use the herbs to get the organs better, the entire body constitution better. Then I use Epsom salt, olive oil, apple juice, and teach patient within 7 days, it normally pass out the gallstone. Okay, this is a great way to do, and you should do your research on it. First, appreciate you share your knowledge. What about the post in this case from friends? Funds. Denise, the post, yes, I do the post to get the constitution right. Okay, And yes, it can do the pose and to get rid of the pain as well. But if the patient come to you with my pose, I don't know what pose they will present because everyone's different. So I treat needle, I use needle according to the diagnose, which is from the pose. I use herbs according to the diagnose, which is from the pose as well. But I wouldn't be able to tell you what kind of pose it will be. Okay, on here we are treating the image. We are treating the organ image. Okay, so we are not talking about getting the other organ to balance. But if I were going to pose, I would be able to tell which organ actually causing the pain, right? And it's just a different thinking to go to the area. Okay, this is more treating the symptoms, and using the pose is more finding out which organ causing the problem out of balance that causing the pain. Or two different thinking. Okay, but by treating the pain, it'll work as well. Okay, but at some time it won't work, then you have to go to the second strategy. This is just one strategy. Okay, I have many strategy. Okay, I would talk about. I'm here to share with you in live video. I can't share everything because I won't be able to share everything, because if you don't know about herbs, and this video is actually for my patient on my page, on my clinic page, that to give you information, to let people know that gallstone and where it come from and what symptom it is and how acupuncture or acupressure point can help. And in reality, there are a lot of people that actually after some people get gallbladder removed and they still feel the pain. Can you believe it? There may be some misdiagnosis in here and they still get the pain, and they couldn't understand, and no one could tell them why would they still get the pain over here, you know. So this is something that people think, well, they might be because, you know, even though some patients they don't have gallstone and they have gallstone pain, and there's been that there probably some problem in the gallbladder and they can see the problem and they remove it and they still have the pain. And what I said is this area, it's good for the symptoms. All right, it won't resolve, it won't pass out, it won't be able to help you to pass out the gallstone. Okay, I don't have experience with that. Just by pressing that or needle here will pass it out. But with gallstone, with the pain, if it's acute pain with gallstone, then you certainly want to put needle in there and give them some herbs or whatever. Okay, so the leg point I'm going to show you Kika. So on GB34, do you know how to locate GB34? So it's about 2 chun below, right below GB34, and GB34 is actually on the this bone called tibia, the head of tibia. I think it's tibia or fibula, fibula bone, the head of fibula bone, and 45-degree over here, 45-degree on the front low, front and below, and about 45, and that is GB34. And with the GB34 and right below 2 chun, that is the gallbladder points. Right? What is the dosage of Epsom salt, olive oil? Are we to mix? No. Amida, you're not gonna mix all this together. No. Epsom salt is just in the very end that you use it. Okay, I have the formula written down in my computer in my office. Okay, and you can Google that. There are a few people have few different idea on this. They will change a bit, but normally it will be the same. we would suggest fresh apple juice, or just get the juice from the supermarket, but it has to be real apple juice to be able to help with that. Okay, and Epsom salt is just a last thing that you need to do, and just try to pass it out. And apple juice and olive oil, you have to do fasting. It's not that easy. Not mix it all together. Yeah, no. Okay, all good. Stay awesome. I'll see you tomorrow in live video, and hopefully I'll see you all both at 2 finger or 3. No. You can't count as the point from using your fingers. Okay, about 2 to 3 finger below the here, GB 34. Okay, so we call it two chun. It's about 2 or 3 finger approximately. Okay, so stay awesome. Thank you. Remember to share this video. Thank you very much. Bye bye.